is Fox 26 Morning News Extra.
9:29 right now, and this summer, one of the places you don't want to take your children to visit is the emergency room.
No, ear infections, sunburns, those top the list of conditions doctors see a spike in this time of year. And Dr. Andrew Kretschmer with Spring Central Hospital ER joins us now to tell us how we can prevent these conditions. Good morning.
Good morning. Good morning. Thanks for having me.
Well, thanks for being here. We know a lot of what you see are ear infections. How do you tell the difference between a swimmer's ear and what may be a normal routine ear infection?
Well, by looking is the best way to do it. Both are just ear pain. The swimmer's ear we see a lot more in the summer now because kids are in the pool. What happens is water gets trapped in the ear, and it's just a skin infection inside the external canal of the ear. You get a little fungus, you get a little bacteria, and it gets painful, and so all the child will feel is pain. They rarely have fever with that, but they'll have pain. The way to prevent that is just prevent water being trapped in the ear. There's a product called Swim Ear. It's a alcohol base that just dries out the ear so the water doesn't macerate the skin, break it down, and infection doesn't occur.
That's after the water has already entered? Is there anything you can do to prevent the water from entering at all? Those stoppers maybe? Those earplugs?
You can do that. They're not terribly comfortable. I'm not sure I really recommend that and all. And there seems to be a subset of children that tend to get these swim ear infections. A lot of kids don't get them. I really recommend you, when you get out of the water, a little alcohol in the ear, which is all what swim ear is, dries out the ears, you don't get the infection, you don't need to come see me.
Another thing you treat a lot during the summer are severe cases of sunburn. What do you classify as a severe case?
Pain.
Blisters, yeah.
Pain brings you to the emergency room.
Right.
Yeah, we see a lot of sunburn in the summer. People don't realize how fast you can get burned and burned significantly in the summer heat. Between the hours of 10 and 2, the ultraviolet rays are really concentrated, and in 30 minutes to an hour, if you're a fair-skinned individual, you can get a really significant sunburn. The best way to prevent that is sunscreen. We like sunscreen a lot. Not enough people are using that. The sun protection factor, SPF 30, is what we would recommend. You put it on about 30 minutes before you go out so it's absorbed into the skin. Will prevent that, and we recommend that. We recommend it for the children, for the small children, the babies even. The SPF 15 would be a good idea. The sunburn that we see can be up to first or second degree burns. People don't realize how badly you can get burned with sunscreen. I mean, with the sun out there.
You said SPF 15 for children. What about
children?
for adults?
Even for babies. 30 for adults. The higher concentration for the adults.
Now, when you see SPF 50, does that mean anything?
You know, it's just a higher protection. What that means is that SPF 50 means that it takes 50 hours of sun to get the equivalent of 1 hour of not having any sunscreen on you. So, but 30 is generally enough for everybody.
And finally, doctor, just real quick, a couple warning signs of heat stroke. Kids are outside many hours a day during the summer, maybe forgetting to drink enough water. What are some signs that your child may be having some heat-related illness and they need to go to the ER?
Malaise, headache, nausea, if that persists, if a child comes out from the sun and they feel this way, if you simply cool them down, some cool water, maybe a fan, maybe even sponge them off with some cool water, generally they're going to feel fine. But if that persists, then you want to come to the emergency room. Maybe some IV fluid might be necessary.
Well, Dr. Kretschmer, thank you so very much for coming in and letting us know about these things that we don't want our children to get during the summer.
Very nice of you to have me, and God bless you.
All right, thank you.
Well, you may remember Katie.